Clean health. Healthy living, illness prevention, and health awareness with Dr. Oby Coucou. Hello, everyone. It's good to have you join us in yet another episode of Clean Health. My name is Dr. Oby Coucou, a consultant cardiologist and a fellow of the West African College of Physicians. I'm excited to have with me in the studio today a special guest in the person of
Farouk Nanobello.
You're welcome, Mr. Farouk.
Thank you.
Can you let us know who you are?
Well, Farouk Nanobello is a practicing journalist, a development practitioner, and also a public analyst. And it will interest you to know that I am very much interested in health communication.
Beautiful. I like that. So, today we'll be focusing on a very important topic known as hypertension. Stay tuned as we come right back. Clean health. Healthy living, illness prevention, and health awareness with Dr. Oby Coucou. Welcome back. Mr. Nanobello, you're very welcome once again.
Thank you, Doctor. It's indeed a pleasure to be a part of this program today.
Beautiful. So you would guide us in the direction of the show or the program today regarding hypertension and ask any questions or concerns you might have regarding hypertension. So over to you.
Well, I would like to first of all thank you for inviting me to this important program. And thank you, viewers out there. It's a pleasure to be a part of this program today, and of course, given the topic of discussion, hypertension, which I believe is one of the global pandemics facing the societies today.
Yeah.
And of concern is the fact that it has been ignored for far too long.
Yeah.
Ignored in the sense that a lot of problems, have happened as a result of the fact that people do not have much knowledge around the issue of hypertension. Some people work in the streets without knowing that they even have this problem, perhaps because of the lack of awareness, and knowledge concerning the issue of hypertension.
Yeah.
So I think it's an opportunity for the viewers out there to get to know more about hypertension and all the issues around it. So it's an honor, actually. Let me first of all ask, Doctor,
Yeah.
you're the expert here.
Yeah. Thank you.
What is this hypertension? Because perhaps it has other things beyond what we think of.
Okay.
People just think hypertension has to do with just people overthinking.
Right.
So, what's this hypertension?
Beautiful question. So hypertension can be defined as a persistent, sustained, raised blood pressure greater than or equal to 140/90 millimeter mercury, with a recent redefinition of the threshold at 130/80 millimeter mercury, or the current use of antihypertensive therapy. In other words, the blood pressure of every human should be less than 120/80 millimeter mercury. However, when the blood pressure is high, it is regarded as hypertension. Now, the heart is able to contract and pump blood through the blood vessels to all the systems and organs in the body. During that contraction, you have the upper blood pressure, and that is referred to as the systolic blood pressure. When the heart relaxes, blood fills into the heart. During that relaxation period, you have the diastolic blood pressure, which is the lower blood pressure. This is usually determined with a sphic, or a blood pressure measuring machine, of which we have one right here.
Okay, Doctor, not to cut you too early. If I'm concerned, you mentioned high blood pressure and low blood pressure. That means there's a sort of a distinction here between the two, definitely. But before we go there, you mentioned 120/90.
Over 80, sorry.
Over 80.
Yes, normal.
That's normal.
Yeah.
Okay, so now perhaps from 120/90 or 140/90, there's a problem.
Yeah.
But the question here is, do we assume that whoever walks into a facility and for the first time is like measured to have, gotten to the blood pressure raises from, the normal to maybe 140 by 90, do we say the person is hypertensive?
Good question. Now, if a person comes to the clinic, for instance, and the blood pressure was incidentally determined and was noted to be high, perhaps let's say 140 over 90, for the first time, and you as a clinician, you've taken a history from the patient and discovered that he has no family of history of hypertension, and this is the first time he's ever been hypertensive in his life, all right? You don't go out to say, and you've clinically examined him, and he has no evidence on examination that he has a long-standing hypertensive heart disease. You don't go outright to say he's hypertensive. What you then do is to give him a 2 weeks period for which he goes home and then monitors his blood pressure on a daily basis. He can use the automated or the digital blood pressure measuring machine at home to check his blood pressure on a daily basis and record it on a chart, so that when he's coming back to the clinic in a 2 weeks' time, you also check the blood pressure and compare and know whether it's persistently, remember I said in the definition, when it's persistently sustained, raised blood pressure, okay? Remember, there are stressors. Things can raise blood pressure, okay? If for instance, there's what is called white coat hypertension. When you come into the clinic and see a doctor wearing a white coat, you're scared.
So that alone triggers...
Yeah, some hormones are released and you're like, the BP can go up because you're scared. Or in the clinic environment, there are a lot of patients, especially in Nigeria. So there's overcrowding. People are hustling for their folders. There's a lot of pandemonium within the clinic environment. It's not so organized. So it tends to raise the pressure of people. Again, stressors like maybe anxiety, emotional stresses, anger, excitement, And sometimes if you have a full bladder or you're in pain, the blood pressure can rise, okay? So in such an instance, you need to recheck the blood pressure in 2 weeks. If the blood pressure is persistently greater than 130 over 80, it's likely the patient is hypertensive, okay? If it's greater than 140 over 90, then you know that he has a severe hypertension by the recent definition.
Okay, now how then should one check this hypertension apart from the other way you mentioned by way of using, the measuring device? Yes,
the measuring device. The only way we'll check the blood pressure is using the blood pressure measuring machine. Okay, and this is known as a sphygmomanometer, or a blood pressure measuring instrument by layman.
Can a common man use this?
This is used by a doctor or a specialist, someone who is trained in its use.
Perhaps there's another one I can use personally in my home.
There is an automated or a digital one which is programmed. You just tie the cuff. You should have an adequate cuff size that you tie, and then use it to check the blood pressure at home and use to monitor. But it's not as reliable as this particular Sphig. So whenever you want to check the blood pressure, you must make sure that the patient is well rested. For instance, if he comes to the clinic, you should sit down for about 5 minutes to rest, so that you relieve all form of anxiety. 30 minutes prior to the blood pressure check, you should ensure that he's not taking any coffee, because coffee can raise the blood pressure. You should ensure that he's not done no aerobic exercise in any form 30 minutes prior to your measurement, and then you should ensure that the patient is calm, right? All right. No food eaten 30 minutes.
So even if you're doing this in your home, you must make sure that you are in a relaxed manner.
Once you're relaxed, then you have a blood pressure cuff size, and there are different sizes. So the cuff must be adequate for the arm. Some people are fat, some people are thin. So you have to have the adequate size for the individual.
And you must tie this very tightly?
You tie it, around the arm. You can give some space between the arm and the wrist joint and above, all right? And then, of course, the doctor will use a stethoscope and then check the blood pressure. I don't have to go into the details of that. But the automatic one, once you tie it, you click on, there's a button you click on, it starts giving you the recording. So it will give you the upper pressure and the lower pressure, and then, that's how. But usually, you should check the blood pressure in both arms, as long as it's the first time you're checking the blood pressure. Because sometimes you could check the blood pressure on one arm and it's lower than the other arm.
That's
there's certain,
another complication.
there's certain conditions that can give that, which I don't want to mention here because the layman will not understand.
So if I get you, even if somebody is to consistently,
no, for
check
the first
himself.
time, sorry, for the first time, not consistent, not every day. So
now,
for
I mean,
the
in the
first
case of a candidate whom you are trying to establish whether or not he is or she is hypertensive, you said you're going to recommend that the candidate should do the check regularly for a time period.
Yeah.
So what I'm saying is, if one must do that, is it okay if he visits the hospital daily to get, the check?
Yes. If he cannot do it at home with the digital, he can visit a nearby clinic where a nurse or a specialist can check for him and then give him the records,
and then
which you record on a daily basis. Sometimes you can do a 24-hour monitoring of the blood pressure. You just apply the instrument every 30 minutes. It gives you the reading, and then at the end of the day, throughout the day, you can check the blood pressure because the blood pressure changes throughout the day. Sometimes it will go normal or low, and then towards night or midnight, 12 midnight or so, there's a surge in hormone, so blood pressure goes very high. That's why you see some people have strokes early hours of the morning.
That's right.
Yes.
It's always the case.
Yes. So
now,
you can give you an idea.
Then let's go into who is actually affected, because there's this concern that even younger people, come down with, high blood pressure. So who is really affected by this?
Yes. Thank you very much, Mr. Nanabalu. Now, a whole lot of people are affected, okay? And hypertension, there is a rise in prevalence all over the world. About 1.13 billion adults are affected all over the world. And even in Africa, there's a rising prevalence. The low middle income countries are more affected. About 2/3 of people are more affected by hypertension. In Nigeria, about 57 million adults or more than are living with hypertension. And about a third of them are aware. 2/3 are not even aware. And of the third of them that are aware, only 2/3 of them are on medications. And you find out that a lot of people are not consistent on their medications. Okay? So it's a global problem, and it's a problem in Nigeria and Africa, okay, because of the westernization of Nigerian Africans. We have adopted Western lifestyle.
Talking about westernization, I became concerned. You also mentioned the issue of poverty. Because you say low income. Low income, as far as I'm concerned, has to do with poverty. And so I am concerned as to, why is poverty having any relationship with hypertension? Is it because of the food we consume, or the kind of lifestyle we live, or the fact that we are not in, I don't know.
Yeah, sure. Good question. It has to do with the lifestyle, the lifestyle of the people. We're adopting the Western lifestyle. For instance, if you look at diet, a lot of people eat more of processed food, canned food,
That's right.
A lot of people do junk food. We live a fast life, so we don't have time to prepare homemade food. Remember, in those days, our parents, when they prepare food at home, they go to the backyard, they pick bitter leaf.
They are very nutritious.
Yes, very nutritious meals that help the body. But right now, we eat a lot of food. We take a lot of soft drinks, sugary drinks, sport drinks.
Regularly.
We take a lot of salt in food, salt in diet, and then we have less of exercise or physical activity because of advancement in technology. We're advancing in technology, isn't it? So we have a lot of computer systems, a lot of, people spend more time sitting and watching those things. So those here in one position. So we have less of physical activity. All these things predisposed. That's why I talked about westernization. So and then again, the urban people in Africa or in the low middle income countries, you find out that urban people are more affected than the people in the rural area.
Yeah, because to a large extent, they still subscribe to some of these kind of foods we eat in the rural communities. Now, let's
clean health living, illness prevention, and health awareness with Dr. Oby Coucou.